shared in the following discussion is not intended as medical advice or for diagnostic purposes. Please seek professional assistance if you're experiencing any psychological or physical challenges. Welcome to Solutions for Life on the Couch with Claudette, psychologist and functional medicine certified health coach, bringing you conversations of hope, healing, and transformation. Hi everybody, happy Thursday. Welcome to our live chat on women wellness, movement, and mental health. So I'm quite excited today to have a chat with Christy Ann Du Plessis. She is a physiotherapist, body coach, mom, wellness blogger, and I think all around just super passionate and enthusiastic about mental health and wellness in general. So I'm going to get Christy Ann on now. Hi, Christy. How are you?
Hi. How's it?
I'm so glad to have this chat with you today. I'm so excited for it. I've been looking forward to it all week.
Me too.
Yes.
Repositioning.
There we go. Now we can see you. Yes, we can see more of your beautiful face. Okay, great.
Fine. There we go.
We can see you great. Yeah, so most people are into the second week now of Movember challenge. So we turn November into Movember, emphasizing just the various mental health benefits of moving, just getting moving. And for me, the main purpose in doing this was to make people aware that there's so many benefits for your mood, for your brain health, for just your emotional well-being in general, just when you get your body moving. And I think also our perception of doing some activity is generally like exercise. And exercise in most people's mind is you must either run or you must lift weights in a gym. Not that there's anything wrong with those things. Those are great things. But for most people who are struggling with mental health or are having emotional challenges, sometimes those kinds of activities pose challenges for them. And for them, moving means doing those things, and they find it quite demanding or challenging. So we've been having this challenge this month so that we can just empower people and let them know from a mental health perspective just how many types of various movement activities are out there, and also just give them some information and also help them see just what they can actually just do from home, just as a starting of place, just to get moving, even in the basic corners of a bedroom in their house. So I'm so glad you decided to join, and thank you so much for giving your time to do that.
No, thank you so much for inviting me. I'm so glad to be part of it.
It's amazing. So will you tell everybody who's on more about Christy Ann, because there's so much to you, but can you just let them know who is Christy Ann? You can talk about yourself just professionally as a mom, share whatever you'd like to so that they know who's split on the screen with me here.
Okay, great. Yeah, so I am a physiotherapist originally and have a special interest in, women's health and mental health, and obviously sport and exercise, and a fitness enthusiast myself. So I'm also a mom of 3 little kids, little boys. And after my first son, I actually battled myself with a mental health. I had postnatal depression. And then I actually can now testify to the fact that I had to practice what I preached to my patients, because I worked in the mental health field and specialized a bit into it. And I can say that it really, really makes a difference in my life. And so, yes, I think that's a quick version of me. And so, sorry, I forgot to say then, after having kids and we moved and I sold my physio practices, I managed to open or start my health and wellness blogging, because I also am a body coach. And then I started online workouts, which is a real passion for me. So that's what I'm doing full time at the moment. I'm fitness enthusiast doing online workouts daily.
That's awesome. That's awesome. So we're going to talk all about that as well, because I'm really keen to hear about that and to let everybody else know about that program that you run, and also give it to them as a possible option of something that they could get involved in. But I want to go back to two of the things that you mentioned now, talking about your physiotherapy work and your interest in mental health. So can you tell us a little bit about that? And then will you also, after that, talk a little bit about your own, if you wouldn't mind, I'm not sure how much you feel comfortable to share, just about your own experience of what it was like having postnatal depression and then having to employ some of those strategies that you were using with your own patients for yourself.
Yeah. Absolutely. I think it's so important to get the message out there, and I really do share it a lot on my blog and everywhere so that people can I want to add value into people's lives with my experiences. So yes, I was overseas a few times and managed to be trained in mental health physiotherapy, which isn't really known in South Africa. So it was at the University of Leuven in Belgium, and was really a great experience. So there's aspects to mental health that physios can actually have an effect on. And the one is obviously your physical activity side, and we're going to chat a lot about that, but there's also the body-mind connection side, and it's also integrates movement and breathing and your mindfulness type of exercises. And then the third thing is obviously chronic pain, and it's also just such an interesting aspect, because it's not just about massaging and mobilizing the areas that are painful, but it's more about reframing the threat and neurophysiological type of education, and then exercise, graded physical activity. So if you have pain, you should actually move. And so a lot about that is very interesting to me, that pain and depression also increase on a linear aspect. So there's so much to talk about, but I know. Sure. Movement is a common denominator.
Yeah. So, I mean, if we just stay on that for a little while, because I think, like you said, there's so many golden nuggets there in what you shared. Just the fact that our natural tendency when we are experiencing pain is to stay still, because the perception is that we're going to cause ourselves more pain, or it's going to be more painful to move. So, for example, for a person who's feeling depressed and is experiencing bodily pain as a result, or has had some kind of chronic condition where they've got anxiety and depression as well related to that medical condition, movement might be sort of like the last thing on their minds. Can you talk a little bit about that?
Yes, well, I think because of the fear of experiencing the pain again, people want to stay still and they almost brace their movements. But it's so important to actually, well, I think first of all, for those people to hear that movement is good, because we're going to increase a release of very good hormones, first of all, when it comes to mental health, but also graded physical activity. There's so much research on that. If you integrate a little bit of movement every day and build it up, you're going to have an effect on that pain. It's unbelievable how many studies show that. And I actually also had chronic fatigue syndrome, and I'd love to share about that.
Yes, go ahead. Please do.
When I was studying physio, I was in my second year, and I had an injury, and it all ended up in a viral infection and then chronic fatigue, which then caused me to not want to move, and I almost stopped studying physiotherapy because of that.
Wow.
And it was just unbelievable to see what movement did for me to get back into it. And I kept on thinking, no, but you've got these symptoms, this flu-like symptoms, and constant long hours to study, and I seem to be losing you. Okay, I think we're back. Is our connection okay?
Yes.
Wonderful. So with fibromyalgia and chronic fatigue syndrome, there's also great research about getting moving, and it actually helps the condition. So I think another buzzword in mental health, which I'm really excited about, is inflammation, and the fact that when we have a mental health issue, a lot of the time it's related to neuroinflammation, like we have physical inflammation, we can have neuroinflammation. And there's also studies that show that if we exercise, then we can decrease that neuroinflammation. And
Absolutely.
it's just amazing because they actually had a look at markers in the blood and saw a decrease. And I was interested to know how, and so I read up a little bit more about it, and it's just unbelievable because there's an initial surge in your pro-inflammatory cytokines, but your body adapts and has a homeostatic response, and that's what causes the inflammation, or the improvement of the inflammation, if you can say it like that.
And I know for some of the people listening, they might be hearing all these words and thinking, okay, what on earth are Christy and Claudette talking about? But I think in a nutshell, what Christy's trying to say is that sometimes when we have bodily experiences, we kind of separate what happens in our body from what happens in our mind, and we think these things are two different things. Sometimes we can think like how we have an injury, like when you stub your toe against something and it swells up, and you can see the swelling and you can see that it's inflamed and red and hot, that it's much more visible. It's much more, it makes sense to us to kind of understand that it's physical inflammation. But sometimes we don't understand what's happening inside our body on a neurological level as well, inside our brain, with all of the various chemicals and neurotransmitters and blood flow and everything that happens in our brain to help us to think and to process information and to remember and to concentrate and to be able to stay, with an even mood. All of these things happen internally in the brain as well as auto processes. And in the same way as like a physical thing, like your toe can get stubbed and be inflamed, this can happen internally in your brain too. And other parts of inflammation in other parts of your body can also have impact on your mental health in terms of these, let's call them nasties, these nasties traveling through your blood-brain barrier also into your brain. So I know we're getting a little bit technical with this conversation, but I wanted to just give you a little bit of an understanding. But if you want to read up, there's loads of information to read up on how experiences like being depressed or feeling anxious can actually be regarded as an inflammatory condition. But Christy, I wanted to bring it back to what you said earlier, that people's natural response is to not do these things. So when we're in a place of, let's say we're in a place of a low, if our mood is down and we're lacking in energy, our natural response is not to get up and move, if we are feeling pain, our natural response is not to want to do something. If we're feeling anxious and or irritable, it doesn't occur to us, to get up, to get out, to do those kinds of things. So even just if you could share, like, from your personal experience, how did you get yourself to that point? Like, maybe give us a few practical things of how did you get to that? Just from in your own personal things that you've been through chronic fatigue, you've been through postnatal depression, and then also maybe what you've seen in some of your patients. Like, what are some of the strategies that you've used to get people to that place where they've been able to actually start to get going?
Yeah, I think the one thing that definitely helps is just reframing the mindset that there isn't necessarily a threat, and or when it comes to the pain, you're experiencing it, and it's fine to experience it, but it's not necessarily an acute a threat, and that often helps that one feels less pain already. But when it comes to the physically getting out of bed and getting up in the morning, I mean, I know that's such a challenge for a lot of people. There are a few practical tips that help me, and I often share it with everyone, and that is to have an accountability partner where you would have an appointment, a physical appointment with someone that is either waiting for you, or you do something online together, or you have someone that you literally pay that's waiting for you, and that really helps. And then you can't just slack because you know someone's waiting for you. The other thing that I find is really helpful is to put it as a recurring event in your diary, because then you literally have to delete it out if you are if you are working and you have a lot to do, you're actually deleting your health out of your diary. So that's the other aspect. I think another thing is one definitely needs to do something that makes you happy. So we all have different personality types. And so someone that doesn't like to be being in a gym, or it doesn't resonate with them, they must rather be out in nature and go for that walk or whatever it may be. So, and find something that works for your personality type and is enjoyable for you. So I think those are the 3 top tips that I would give regarding that.
Yeah, I think that those are so helpful, because like you said, just having someone else maybe that's available that you know is going to be either waiting for you or doing the activity with you. It might not necessarily be only like a person that you pay, it could even be like a friend or someone else that wants to also exercise when you know that you're doing that activity together. So it can also be like you're maximizing your time, where you're getting to see somebody and you're spending some quality time with somebody socially, but you're also getting time in with that person together. I try and do that myself sometimes, where you want to see your friends and you want to catch up with people, but then you only have limited time. So thankfully a lot of my friends, we have the same interests. So if I say to them, like, how about a walk on the promenade, or let's so rather than sitting in a coffee shop, although sometimes we enjoy doing that too, we might just grab our water bottles and go for a walk and catch up, which is such a great thing to do. And making that commitment to yourself, like you say, if it's scheduled in your diary, then it seems like that makes it a bit harder to say no to that. And I think the last point is that you made is so important, finding an activity that you like, because there's a lot of research that points to that. Something that intrinsically motivates you, that you have a pull or draw towards, there's a much more higher likelihood that you're going to stick to that and you're going to see that through, because there's something attracting you to that activity. There's something that's pulling you there, because it's got a natural reward in it for you, rather than, I think you used that word earlier, saying mindset. Rather than us having this narrative, this dialogue in our head that says, I have to do this, or I must be doing this, like going to the gym is good for me, I have to go, I must go. And those things tend to be like these voices over us that they become more like expectations over ourselves, rather than saying, I really love to dance, let me put on some music and move, and then before you know it, half an hour's gone and you've been moving for half an hour because that's something you really love to do. There's a difference in those two things. So tell us also a little bit more about your interest in women's wellness and women's health. And I know that I've read some of your writings on just women and hormones and biochemistry. And can you talk about a little bit of that in relation to one's emotional well-being and movement?
So I think that's another area in physiotherapy that is a little less known, and women's health physiotherapy. And that is actually, it has to do with your pelvic floor and your pelvis and the biomechanics of that, and pregnancy and postpartum, and also the hormonal changes that we go through while breastfeeding or when you stop breastfeeding. It's very interesting aspects to consider.
Wow.
So I think, yes, when we exercise in pregnancy or postpartum, obviously there's a lot of changes one needs to make when it comes to the exercise, physical exercise, and things that we need to consider because of our change, relaxin, and postpartum, we need to knit everything back, and depending on how long you breastfeed, because I think I'm trying to knit it together with mental health again now, but it's a bit more physical this side that I'm focusing on. Yeah. So I think, yes, the one thing that I could give advice to, if it was a mom that wanted to start exercising again after pregnancy, it's so important to start slowly and to get the correct breathing pattern back after a change in the, obviously your intra-abdominal pressure changes during pregnancy, but afterwards we need to get the core strong again, and our breathing pattern has changed sometimes, so we incorporate breathing with pelvic floor stability, and also we consider the fact that when we've got increased prolactin and when you're breastfeeding, our tissues are a little bit weaker, And so, yeah, there are a couple of things like prolapse and incontinence and those type of things that we help with. So there are a couple of ways that certain exercises need to be done differently in pregnancy and postpartum to get back to where you were. But it's very interesting. I think I can maybe just add this aspect, knitting women's health physio and mental health physio together, and that is that the pelvic floor carries tension just like we carry tension in our shoulders and in our muscles when we are anxious or stressed. So they're actually also very
amazing.
I know I'm sometimes technical, but please stop me if I...
No, I think that's interesting.
So they actually had a study on how women that were watching a scary movie, they had electrodes on the pelvic floor, and just like we know we get tense in our shoulders because of stress, and scary parts, the pelvic floor would contract, and just like we have spasms in our shoulders and our necks from stress, we actually can have spasms in the pelvic floor. So hypertonic pelvic floors can cause pain and difficulties during, sexual intercourse and things like that. And when we carry tension in the pelvic floor, one would think it's tight, but sometimes one can leak. So this is this is a total different topic for another day, but it's just very interesting that we can actually relax the pelvic floor with breathing strategies, just like we incorporate breathing into our body-mind connection. And I actually literally, although we do high-intensity cardio exercises, I still incorporate breathing and the correct strategies to be able to protect the pelvic floor and knit together some ladies have a split or diastasis recti after pregnancy. So that's how I just make sure that it's there's a safer option when it comes to exercise and that we incorporate the breathing. So it's difficult to knit it together properly, but...
But I can see so many connections there, because some of what you're saying is that, like, if a person battles with anxiety, for example, and is just maybe experiencing chronic stress, there's a likelihood that the obvious aspects of our physical well-being, like neck, shoulders, experiencing headaches, the things that we see more obviously that we tend to take care of, like we tend to say, okay, let's go for a massage, or there's a likelihood that we might be missing other aspects, like we might have like this tight pelvis that you're talking about that also needs some attention, and moving in certain ways and incorporating certain movements and also breathing alongside with that would also help to relieve that kind of tension there too. So just knowing that's incredible, because I had no idea about the fact that you're saying watching that research about watching a scary movie, that implies when we're going through just normal, anxiety, stresses, which is that fight or flight response, when fear is elicited, I'm assuming that would happen if a person was anxious or going through stresses in their life, that the same thing would happen. And I think
C-section scars and things like that is also very interesting, because our fascia in our body also has life. And maybe I can quickly share that. It's quite interesting. I don't know how much time we have left, but
no, it's not some time. I think we have lots of moms that might be watching, so it might be helpful for them, because moms do go through various types of stresses, and for them, emotional well-being encompasses so many different areas. So a mom that maybe has had a C-section, this might be interesting information that you could share. So go ahead,
I think that fascial release definitely has a place physically, but also with our emotional well-being, because there's a study that was done on tsunami survivors, and it's very interesting that they actually followed them, and obviously after this traumatic experience, their range of motion, their flexibility decreased quite a lot. And fascia actually has, I think, 8 to 10 times more sympathetic nervous fibers than muscle does.
Wow.
So fascial stretching, which I also incorporate into my workouts, it's unbelievable what it can do for you when it comes to just your mental well-being. So loosening up and stretching and becoming more aware once again of your movement and your posture is very important. And another thing that's very interesting is they found in studies that the patients that had recurrent major depressive episodes or disorders were the ones that had the more kyphotic posture. So what's interesting is the opposite can be true through biofeedback. If we focus on ourselves and our postures and our breathing and our exercise and routines, we actually can improve our posture or improve our mood through improving our posture. So it's not bad mood or like difficult times that's going to cause us to have bad posture, but we can improve our posture and improve our mood through that. So it's a very interesting aspect to consider.
So you're saying that just even working on these stretches and facial release and posture can actually be like a form of self-compassion in a way, where you're actually being kind to yourself, you're actually nurturing yourself, and you're allowing yourself to work through sometimes releasing some of the negative or uncomfortable, distressing emotions, and then enhancing some positive emotion and improving the state that you might be, leading to like a more positive state of well-being just through those physical activities alone.
Absolutely. Yes, absolutely.
So, that is so incredible.
The training that I did overseas, there was some psychomotor therapy and body awareness therapy, which was really interesting, and it also incorporates that, which is really great. So I think the be all and the end all is that if we pay attention to ourselves and become more connected with our physical bodies, because often we are dissociated from our physical bodies because of being busy or feeling stressed, or yes, we can actually have an effect on that. But I think one of my biggest exciting parts of the mental health aspect and exercise is just that I'm quite visual, and I actually would love to show you a picture of
yes, please do.
Yeah, of a patient's brain that you asked me about experiences of patients and things. Let me go back to the beginning. If I did an exercise session with a mental health patient, I'd always check not only the pain, the visual analog scale of pain, like 0 to 10, how is your pain levels, but also what is your mood like, and your stress levels, and just in general, your tension. And always, after the half an hour session, we would always have an improvement. And so I've seen it, but also if you look at the chemical aspect again, I just love to share this, and it is regarding the release of brain-derived neurotrophic factor if you exercise. So it's amazing to see what brain-derived neurotrophic factor can do. So please stop me if I'm being too technical again, but it can cause a growth of your neurons. And when there's definitely studies regarding, and you know all of this, you could probably tell us, but there are studies showing that the hippocampus can actually lose volume if we are exposed to long-term stress. But now there's studies that show that if you exercise a certain amount, that hippocampal volume can increase because of the brain-derived neurotrophic factor. So it's like a protein or a hormone in the brain that causes improvement in synapses and angiogenesis, which is like formation of neural blood vessels. And I just get so excited to like think of the physical.
so if I can pause you, so I can maybe translate some of this jargon for the people that are listening. So what Christy's trying to say is that, okay, so the hippocampus is in your brain is responsible. It's like a temporary memory store, and it holds all of your short-term memories. And then when you're sleeping and you're resting, your brain can sort of sort them out. It can put these experiences and memories and what you've gone through and store them and consolidate them. So under stress, and when you're under chronic stress, or when your brain is under protracted states of anxiety, what research has shown is that your hippocampal areas in the brain can actually decrease. So that means this is why many people complain of memory loss, poor focus. So when they're distressed, or when they under periods of anxiety or chronic stress, one of the quickest first complaint is battling to concentrate. I seem to be so forgetful. I'm losing my memory all the time, and it's often because of this. So what Christy's talking about now is how exercise has shown to increase BDNF, what she's talking about now, and how that actually improves your hippocampus. like the hippopotamus in your brain. So carry on, Christy. I'll just interpret for you.
I won't go technical about how much exercise you need to do and what you need to do to get that release, because there are different studies for different things like major depressive disorder to get the BDNF, whatever. But there's just a general rule, which I actually try and stick to, which is 5 times a week, half an hour of moderate exercise. But this study that I want to share with you was a mental health patient that only exercised 3 times a week, so it's a bit less than what the guidelines would say, and half an hour, and he didn't change anything else, and the hippocampal volume actually increased, so the brain tissue increased 20% or 19.7%
Wow.
within 12 weeks. So
wow.
Very interesting. I think the intervention time is definitely 10 weeks before you start feeling the difference if you're not taking medication, so you're doing really just doing the physical activity, but and if you stop, I think the effects diminish within 1 to 2 weeks, which is really interesting. That's also just what some studies show. But this guy, I'd like to try and show you. I don't know if you can see the picture nicely, but there are 2 pictures, before and afters, and you can literally see the increase from top to bottom. I don't know if you can see it, but it kind of just gives you something to work with in your mind.
Wow.
So
that's amazing.
Just one study, and they really are a couple. But it just excites me, the fact that you can really see the impact that it has on one's mental health.
Yeah. So for a person starting off at home, let's just say it's a mom who has kids, or somebody that's still working from home online, and they're a little bit restricted, with all of the numerous benefits that we've spoken about. We've spoken about just, facial release and doing certain stretching, certain types of movement that can, and breathing that can unlock and can release emotions. We're talking now about BDNF and actually changing the structure of your brain, like movement altering your brain. There's so many things that a person could actually have an impact on, and can take their well-being mentally into their own hands. Like, it could be overwhelming for a person. What are some of the basics? What are some of the basics that you can encourage, like simple basics that a person could just start with from home, if they're listening to us and saying, oh gosh, I think I need to get going with some kind of movement activity? What kinds of things would you suggest that they could start with?
Yeah, well, if you prefer to exercise at home, I would say find some guidance. I think online guidance helps, but the basics would be starting slow and starting with small bouts of exercise, and maybe some functional type movements like a squat and a lunge, and keeping alignment and allowing your core to give you that stability. So we are at least focusing on healthy movement patterns to build up the right movement patterns to be able to go further into a high intensity exercise. So ultimately we would want around 150 minutes per week of moderate exercise. And moderate means, I think I said it, you can hold a conversation or you can talk, but you cannot sing because you're too out of breath to be able to sing. So you can try and keep it on that intensity, and just start with a few reps and build it up. So I think functional, if that resonates with you. Otherwise, go for a walk and build it up. Build up your distances and your intensities. So it depends again on what you enjoy for exercise, but definitely starting out slow and small, and then building it up so we don't injure ourselves or just lose momentum. So I would suggest that, if that can help.
Yeah. So I know that you started off your own initiative, and it was something that you, it's obviously, like you said, exercise and movement is a passion for you, something that you worked on for a while with patients and also yourself, but you also started off an initiative in terms of being able to empower women. So tell us more about Christy Ann Fit and how people can get hold of you, how they can find your program online and what it's all about, and some details of it. Yeah.
I have got some places where one can do some free workouts and try them out on my YouTube channel, which is Christy Ann Fit, and then one can follow me at christyann.fit, either on Facebook page or Instagram. it's at Christy Ann Du Plessis. And then one can also subscribe to my workouts, which are a low price. It's 160 Rand a month. The idea was just to get as many ladies together, a community of online workout buddies, to kind of stay accountable to each other. And I am live 8 a.m. daily, Monday to Friday, for a half an hour body weight session. And I have a variety of different exercises, which includes our cardio and our high intensity, and then some strength training, getting those healthy movement patterns so we can build on that. And so, yes, it's lots of fun, and the recordings are available if one does subscribe. So one can do it anytime and pick and choose from the recordings anytime. And the other option is to go onto my website, which is also Christy Ann Du Plessis, www.christyann.fit, and subscribe to my newsletter. And then you'll also hear from me regarding health and wellness. So I do encourage you to try some of these workouts, or whoever may be watching, because it is a lot of fun. And I guide everyone regarding your correct form when we're exercising, but also it really is a nice community to belong to and try and stay accountable to for movement. And there's an easier version and a more difficult version, which helps, because beginners do the easier version, and also the pregnant postpartum ladies. They, I don't say I'm specialized in that now, because it's actually more high intensity type of things. But those that want to can do the easier version, and then build up to the intermediate and higher intensity. Kind of lost you there. So every exercise has an easier version and a more difficult version. That's what I was trying to say. Yeah.
So you're putting together obviously the movements for people that they can, even though they're working from home or from work or from wherever, they're still getting technique, and they know that they're being safe and looking after their bodies. And then there's the variations, like you say, depending on what level they're at, what's going to be suitable for them as well.
Absolutely, yes. And I really try to open up the anterior structures. I think a lot of people are sitting in front of a desk a lot, or sitting a lot in the day. So we become overactive in certain areas and short in certain areas. So it actually really does help to loosen that up, as we mentioned now, with regard to fascial stretching and awareness. So that
especially for all the people that are working a lot online and from in front of a screen still.
Yeah, so I cue in our body weight sessions, I cue the correct alignment of the neck, which is generally too forward because of our phones and our computers, and try and open up the anterior hip structures. Like our hip flexors are often quite shortened because of sitting in front of a computer and such things. So it really, I think it's a general full body overdo.
Yeah. And like you say, all of these things are indirectly affecting our posture. And if our posture is affecting our mood and our emotional well-being, then working on our movement is definitely going to improve our mood and our mental frame of mind. So that's awesome. So Christy has also very, very generously put together a short little workout video, and I'm going to post that later on today. And so you can get sort of like a demo of the type of activities and movements that she does and how she does them. And so that will also give you a little bit of a sneak peek, so that you can then go further and hop onto all of the various social media platforms that she's mentioned already, and go and check out some of the workouts. And thank you for doing that, Christy, for sharing some of your expertise with us free of charge. It's very generous of you. And then I'll post that later on as well. It's been so incredible. I mean, I think we could chat about some of the things that you spoke about, some of the research for the entire day, most probably, you and I. And maybe we can have another chat another time soon. But thank you so much for your time. It's been so insightful. And I've learned so much myself as well that I didn't know about. And it's been just absolutely amazing. So thank you for that. And hopefully we'll be in touch, and we'll see you again soon.
Yes, thank you, Claudette. I loved chatting with you guys. Thank you so much.
I don't know if there's any last minute comments or any parting words you want to mention.
I think that I just wanted to say again that on my Instagram TV, if you want to do a full workout, like this was now a little snippet of a few easy movements to start off with, but one can also go to my IGTV and also find free workouts there. I forgot to mention that.
Okay. Oh, that's awesome. Okay, so there's some on your
yes,
okay, and that's
certain
your
events, like public holiday workouts, you'll find the past ones there, and a couple
so people
of
could even just use that to start off with and get familiar with it and see what they like, what it's like, and we'll go from there. That's amazing. So generous of you. Thank you so much, Christy Ann.
Thank you
Awesome.
for inviting me. Thank you.
It's been so much fun. And we'll look forward to seeing more of you.
Yes, we'll chat soon.
Thanks, Christy.
Okay, thank you.
Bye.
Bye.
Thank you for tuning in. Remember to hit that subscribe button so you can be notified when future videos like these become available. I hope that you found today's conversation beneficial. If you require any psychological or health coaching assistance, you can make contact with Solutions for Life using any of the links in the post description. As you continue on the rest of your day, reflect on the words of Ralph Waldo Emerson. What lies behind you and before you pales in comparison to what lies within you. Take care until next time.